Thank you very much. So, hello everyone. Good evening. Adrian invited me to join him in this defense of a cautious approach to the regulation of e-cigarettes, and he said, "Come and join me. We'll be talking against Colin and Alex." And I thought, fantastic! I get to argue against harm reduction with Alex. That's a good start.
That's not quite what I said.
And I have to say, I mean, my initial presupposition for e-cigarettes was that we should just kind of flood the world with them, that they're likely to, as Colin was saying, they're just likely to be so much safer than tobacco, and that this was just excessive cautiousness on behalf of the tobacco people who were a bit strange. So I was on the kind of 6th floor at WHO, and we had 2 tobacco peoples, both of whom were strange. On the opposite side of the building, we had the Tobacco Convention Secretariat, and you know, secretariats are the ultimate bureaucrats, and so they were really all concerned with getting the countries to follow the procedures of the Secretariat. And there was another group which was actually more public health focused, which they called Tobacco Free Initiative. And this was full of people who were convinced that we were going to rid the world of tobacco. And we were on the other floor saying, you know, a drug-free world by 2008, we can do it. We were trying to say that this is really the wrong approach, and that you've got to stop pretending that you can kind of get rid of the drug problem by kind of making it illegal, or, you know, that we have to accept that we are people who have kind of certain predispositions to use addictive substances, and that, you know, we need to be we can't imagine that that's suddenly going to change overnight. So I was thinking that this was just the tobacco people's, you know, belief that they need to rid the world of anything containing nicotine. But certainly I realised that this is likely to be a harmful product, and that there certainly should be a degree of caution involved, and that it was not clear what is the best regulatory mechanism for this. So with that in mind, I started looking into this a little bit more, and I have to say the more I looked into it, the less and less clear it was what is the best regulatory mechanism, and less clear that we should just kind of flood the street corners with e-cigarette devices, and that perhaps we may in fact be better off saying to those companies that wish to sell their products that they haven't quite got a product that's fit for sale at this point. Anyway, so let's have a look at...
We're just getting a little sibilance.
So you've seen the range of tobacco devices, and as you know, one of the problems is with this field that really the literature is all over the place, and that it's partly because there's so many different devices, different concentrations of nicotine, different wattages, different... you know, there is a lack of clear thinking about what are the real scientific questions we need to answer, and certainly a lack of rigorous studies to go through them. So I started thinking about it. So what are the advantages for cigarettes? They are probably safer than combustible cigarettes. You know, I think that's you know, they are probably less harm to others from passive vaping than from passive smoking. They may help people quit smoking. They may facilitate a further reduction in combustible smoking in the community, and they could result in, we could say, massive public health benefits. So what could possibly go wrong? Well, they may not turn out to be as safe as we'd hoped. They may delay quitting in smokers. They may reverse the current trend towards fewer and fewer smokers in the world. And they might lead to a creation of a powerful e-cigarette industry with a large lobbying and marketing budget, and the net effect could easily, in some conditions, be negative for public health. So which of these two is it? So we just do a model, and we'll kind of plug all the data in, and then we'll have it all figured out. So we don't have most of the things needed for this model, unfortunately, to work. So let's have a look at what we do. So, you know, I'm not an expert in assessing the safety of the thousands of chemicals there are in nicotine, and it's particularly, I was looking for somebody to definitively show me how we can quantify this 95% reduction in harm, and it's difficult to find. So the best thing I think I could find was WHO's systematic review of the health effects of electronic cigarettes. Maybe this is not the best review, but it had WHO on it, so I thought it's got to be at least unbiased in the process. So what do they tell us? So as Colin was saying, there are a bunch of mild adverse effects related to the vapor in the throat, and they certainly have less carcinogens and metabolites. There are less chemicals that could do harm, and the concentrations are generally lower. But there are some for which the concentrations are worryingly high, and I certainly am not in any position to make any kind of quantitative estimate as to what this risk results in, and neither could I find anybody else, I have to say. Anyway, but let's have a look at some of the other things. So the effects on the lungs are certainly effects on lungs. You have the increased resistance. So you can get COPD. You have increased flow resistance. I don't know if it's as much as with tobacco, but you do get some flow resistance from long-term vaping, it seems. There are conflicting results on the impact on the cardiovascular system. You do see some blood pressure rise and decrease in oxygen saturation, as was reported. Some report blood pressure rise, some lowering. There is no consistency in the data on that one. So there is evidence of oxidative stress. What do we make of this? So it's very difficult to summarise this in terms of the way we like to summarise things for clinical trials. So the animal studies, there are markers, things associated with disease. They're again difficult to quantify. We see lung disease, you see inflammation, you see things that are worrying. How do we quantify? Certainly this WHO report wasn't prepared to quantify, and I couldn't find anyone able to quantify the degree of safety, the degree of reduced risk. I don't know that we maybe the 95 is right, but it's certainly, there is no scientific consensus on this. I think it's fair to say.
Can I ask a question there?
Yeah.
Could you repeat? I just saw Colin almost jumped in. He said there was a connection with COPD and airways resistance in long-term users. Presumably that World Health Organization document must have a good reference for that.
There are a bunch. Yeah, I don't know the reference name off the top of my head, but I have seen studies showing lung resistance from and it's reported in the findings on the increased resistance, increased flow resistance, and I mean you don't typically see these things when people start smoking either. It's often a longer term thing. So I don't know how long you need to follow people before you can adequately assess the degree to which that's less than smoking. It's probably going to be less than smoking, but how much, I don't know. And I don't know that anybody's followed people long enough to find that out. But that's what they found there. Yeah. We certainly don't see masses of cancers appearing from the e-cigarette use at the moment, but is it too early is the question to know that. So anyway, it's difficult to quantify the risk. Anyway, so if we just park that to one side for the moment, but we don't have good data on the degree of the risk, what are the other factors in our equations? So one of them is, do e-cigarettes increase the likelihood of tobacco cessation? And again, you would suspect that they would. So again, there hasn't been a lot of good research. For the size of the market, you could easily spend a lot more on clinical trials in this space. And we have these two studies in 2013 with kind of perhaps not the optimal product for this kind of nicotine delivery, and they're compared against placebo, and they have a benefit against placebo, twice as likely to sit against placebo. When you compare against NRT, there's only one study, and there's really nothing there. So we have something that, in those studies at least, hasn't demonstrated an advantage over NRT. Again, this is a $3 billion market at the moment. Why are there no trials, that can demonstrate whether or not we're going to increase the likelihood of quitting? So there's a meta-analysis of cohort studies, and again, there's the study that Colin mentioned, which states an odds ratio of six-fold reduction in cessation rates, and this is the problem with cohort studies in this to answer this kind of question. So they've taken people who are using their vaping device every day, and they've said, well, how many more people in this group have quit compared to all the others? And obviously, if you're using your vaping device every day, you're much less likely to be smoking than if you're using it every second day and probably smoking in between. So it's not an ideal way of answering this question. In fact, if you look at the studies overall, the cohort study meta-analysis shows a reduction in quit rates for e-cigarettes. So it's again, I don't think we can say that there is good data that they increase your chances of quitting overall. There may be subpopulations for whom they do, and maybe we just need better research because it's really small studies, and maybe it'll turn out that they do, but we don't have definitive data in the normal way we would expect it to do that. So what else can we plug into our model? So I thought, given that we have so little data from this model, let's try a simple model. You can either be a smoker or a non-smoker and you die. And you can, that's the basic thing. So then we add in vapors. We've got non-smokers and non-vapors, and that's the way we're born. And you can either be a smoker or a vapor, and then from one of those things you can go to a smoker and a vapor. And from each of these situations you have a risk of dying or getting sick at any time point. And then you plot this over time and you think, well, what is the likelihood that we're going to have increased harm over in the longer term? And relatively quick, you don't need to be a kind of sophisticated modeler to think that the rates of when people take up vaping, do they stop smoking or do they continue both? Because if you believe the tobacco people, and even though they might be a bit strange, they've done lots of research showing that reducing your cigarette intake doesn't dramatically reduce your risk, and that the putting a small amount of tobacco particulate in your lungs every day is not a good idea. So the extent to which the model is going to be in favour of vaping is really the extent to which we have people over here, and not in this smoking vapor category, and not that the vapors move fluidly between the smoking and vaping. And we know that in the longer, if we look at the people who smoke as adults, the vast majority, 90% perhaps, started as adolescents. And so that's really where we're likely to see the best value for our model, is what happens with young people when they start vaping. We've seen the kind of reducing trends in students in Australia. Whoops, I wanted to do this in this order here. I wanted to show this one first. So, and there's a study recently came out of Poland, and you see there's 2 years, so that's 2010-11 and that's 2013-14. And so if you look just at the light grey one for a second, you see that 60% of these adolescents have ever smoked a tobacco cigarette, and 10% of them have used electronic cigarette. This was in 2011. And then obviously now there's been a huge increase in electronic cigarettes. They've gone from 10% up to 60% in the last in 2 or 3 years. And There's also been increases in current tobacco smoking and current dual use. So in Poland at least, it doesn't look good for our model. So what about, you might think we don't really know what situations like in Poland. It's quite a big country, but let's have a look at, America, where we compare everything to. So in America, they do a study every year on monitoring the future. They study all their school students every year. And you can see since in 2013, they've been asking about e-cigarettes since 2011 or maybe earlier, but only in 2013 did they ask people what they were smoking in their e-cigarettes. And so that's why there's a dotted line here, because there may be slightly different questions, but they didn't ask them if they were smoking nicotine prior to that. So you see that there has been a marked reduction in combustible. This is tobacco basically. There's been a big reduction in people who are only smoking tobacco. And there's been an increase in e-cigarette use here. So, you think, well, that's good. It all looks good. But then when you look at the total number of people who are using tobacco of any kind, there's been no reduction at all. So if you add up these dots here, you get this little thing here. And then if you look at the high school students, again, you see a dramatic reduction since 2011. But when you add up any use of tobacco, it's actually gone up in the last year. So,
can I just clarify,
yeah.
Are you calling nicotine products tobacco?
No, I'm not calling the nicotine ones tobacco.
You are actually.
Am I? Have I added them up wrong? Which one of them?
The tobacco's dropped, the nicotine.
So this is the tobacco line here.
Yes, that's right. That's dropped.
So that's dropped.
And the blue line is the e-cigarettes.
The blue line is e-cigarettes. So
That's
if you
gone up with
that's gone up. No, sorry. The black line is e-cigarettes. E-cigarettes only is the black line. So everything other than the black line contains tobacco, isn't it? Which one doesn't?
All of them other than tobacco.
So combustibles means tobacco. Combustibles. They all contain tobacco.
So you're saying so that's still combustible?
Yeah, combustibles is the word they use for tobacco in the Monitoring the Future survey. So there are various combinations of tobacco with other products.
I'm sorry, with the combustibles, are they actually distinguishing between smoked cigarettes and chewable tobacco and dissolvable tobacco?
Yeah, so they're not considered combustible.
Okay.
Where's the comparison between tobacco products and e-cigarettes then?
What do you mean comparison? So these are the different categories of, if you look at you can be, this is their version of my kind of vaping and smoking, or vaping and alone, or smoking alone, or combination. So you have, this is e-cigarettes only.
Right.
This is combustibles only. Tobacco, that's like cigarettes only. Then the blue line there's a combination of tobacco and e-cigarettes. The grey line is a combination of combustibles, non-combustibles, which is the ones that you referred to, which is like the other forms of nicotine, which are non-combustible, like the tobacco, like snus, like the dissolvable tobacco. Combustibles only, that's tobacco smoking basically, and non-combustibles only is like snus and so the non-combustible, but this is virtually negligent. These are people, that's the kind of so this is probably, this is you might argue the safest form of nicotine, but it's a negligible contribution in the graph. So that, I think the maths is right, that there has been no reduction in combustible use in the US associated with e-cigarette.
Can I ask you?
Yeah.
So, firstly, the product is not thought to reduce use of tobacco, is it?
As in when it's targeted and when it's prescribed as a tobacco cessation device, or just freely in the market?
Freely in the market.
Well, that's the question, really, isn't it?
What you're showing here is the proportion of ever used a tobacco product.
So this is ever used.
Is largely the same.
That's right. I couldn't find more recent
So
use.
the more question is the amount used.
That's right. I couldn't find data on that. I couldn't find it.
And a lot of these studies actually, and they equate ever use with ongoing use, which
Yeah,
is not necessarily
so
the case.
particularly American studies like to focus on ever use, of anything.
Because
But-
nearly everybody's ever used tobacco. Like,
Yeah,
how many
see,
people
even
have
people-
never had a single cigarette in their
So I would have liked to
3 out of about 40.
So unfortunately, I don't have the more recent use for the American, but we have the more recent use for the Polish adolescent sample. And in Poland, the more recent use has gone up with since the e-cigarette has come in. I don't think you can assume that it's gone down. I think we just need to check. We need to we need to look at the data. And I couldn't get it out of the monitoring the future thing. I don't know whether anyone has it, but it's yeah. So
Nicolas, is your reading of this that total nicotine use has increased and total numbers of people using tobacco in some form or other has not fallen?
So in Poland, the total exposure to recent use has gone up.
In the US?
In the US, the total ever use has gone up, but we don't know about the recent use. But they do tend to go together to some extent, even though we know they're different things.
Referring to the Polish data,
Yeah.
I imagine that there are many other factors than vaporizer use contributing to that. For example, the increased westernisation of Poland over the last 10 years. So there's confounders in that data, I'm sure.
Nicola, could you repeat that?
So the question is, does this represent only do the changes in Poland represent the introduction of e-cigarettes or other factors also? So look, I don't know that, they're probably, I think Poland's been fairly westernized for quite a long period of time. So, and this is a quite short period of time. It's like a 2-year time period. I don't know that it would be, that it would be explain that kind of, we're going to see a kind of 15% like a 30% change in tobacco use due to other factors. But that these are kind of ecological studies. They may, there could well be other factors that are driving up tobacco use. In most parts of the world we're seeing, that's not, in most parts of Europe we're seeing tobacco use going down, certainly, so, yeah. So, I don't have that, I found it difficult to get the kind of the detail in the data that I wanted to be able to kind of better answer this, and I think we should be able to do better anyway. So on the other hand, does e-cigarette use increase the uptake of tobacco? And look, it is possible that it does that. Again, these are really not the best kind of methodology to answer these questions. So you do see that e-cigarette users are more likely to smoke, but there could be a whole range of functions for that. And there's an attempt to adjust for that in a WHO study, but I don't believe that adjustment always works. So I don't know what to make of that.
Well, that association could be either way, couldn't it?
That's right, yeah. So you try and get rid of that adjustment, but yeah. So what have we had though? But there has been this massive investment in e-cigarettes recently, and we do have an e-cigarette industry. It's largely very closely aligned or owned by a tobacco industry. It's kind of estimated at the billions of dollars, and in some countries they are advertising their wares. And I think this kind of sums it up. Like, why quit? That if I was selling something, I wouldn't want somebody to quit either. That's the female version. And certainly, of course, we can't. We have to have plenty of gratuitous kind of sexual images, but just to make up for that. So, if we have a legal, if we have an industry that's able to influence people, they will try and influence people, and they will pick celebrities, and it's not really cool, I don't think, vaping in Australia. It's not, it just doesn't, I don't think tobacco, in fact, smoking cigarettes is not really cool in Australia anymore, but kind of, but people will try and make it cool, that's for sure. They'll try, they will try and change our perceptions of whether or not it's something that is a desirable thing to be seen doing or not. And it may, this may have unpredictable consequences. So there are these new tobacco formulations, which Colin's got here, which I don't know that everybody knows. So this has got tobacco in it, but it's not burnt, it's heated. And you put it in one of these devices. So this is not an e-cigarette, it's an actual, I don't know what category it is, but it's heat not burn, they call it. Yeah, so it's but it's a nicotine product, and I don't even know that it's any safer at all. But that's, and they've tried to do a non-heated version. I think certainly a lot of the risk comes from heating, but apparently to Colin this one was a flop because it didn't give the bang that people were looking for. But we could. I feel like we're in a kind of game of chicken with the industry at the moment. There is certainly massive public health harms from tobacco use, and there's a kind of product that's kind of, not really an ideal product that, then we're kind of saying, well, who's going to flinch? Are we going to say, no, come up with a better one, or are we going to say, we'll take what that is because, we worried that it's what we have is worse. So, here, this is the US Surgeon General's comparison of the potential harms and benefits of e-cigarettes. So in their benefits, they think that there is probably a reduced disease risk for current smokers who completely switch to e-cigarettes. Reduced morbidity for smokers with existing heart or lung disease who switch to e-cigarettes. Perhaps that's even only a partial switch, I don't know. The potential for kind of getting rid of combustible products and fewer users of combustible products. These are the, potentially the benefits. But, and the potential harms they list is increased use exposure to nicotine. We haven't even talked about the possible negative effects of nicotine, purely nicotine exposure in the adolescent brain. Nicotine is a powerful reinforcer, and people, even nicotine smokers, have a kind of a tendency to kind of value short-term effects over long-term effects, the way kind of the way heroin users do. In fact, it's one of the best ways of distinguishing between. And you see that current smokers also do that, and ex-smokers don't to nearly the same extent. And the potential for harm just from nicotine adolescence is also unclear, I think. So, and then there's on renormalization, future disease risks of use, increased use of dual e-cigarettes, serving as a gateway to the increased risk of disease risk versus complete cessation among those who use both, and exposure to secondhand aerosol, which probably safer than smoke is itself not safe. So I'm getting the wind up here. So. Yeah. So my last slide, how do we regulate it? So one is the prescription-only model. So there is no approved nicotine product, but there are some products that you can apply for a CTN trial for example. So we could do clinical trial research with nicotine. We could get, even with vaporizing devices. So we could do research, and then we could have like medical availability to high risk, mental health patients, severely dependent people, moderately dependent people. We could work our way down the likely candidate until we reach the point where we find it difficult to demonstrate a benefit. We could look at the kind of Portugal model for illicit drugs, which is that we don't punish people for using it, but we don't allow the marketing of it. It remains illegal. And if people do it, then you may respond with a kind of civil penalty or something. But that's kind of similar to what's happening here at the moment. There's no enforcement that I can see of kind of the nicotine purchasing under the counter. We could move to a kind of tobacco regulatory model. with no marketing allowed, or we could move to a kind of a model like alcohol where marketing allowed, which is what we have in the US at the moment, pretty much, I think. So I think we should start with the prescription model and try and demonstrate the benefit and see if we can force the industry to come up with at least some data that what they have is definitely better than the current circumstances, or else come up with a better product. Which they have the money, there is an enormous amount of money, and I think somebody will come up with a nicotine delivery device that gives people a certain hit with kind of able to demonstrate a safer result for it. Anyway, sorry I've gone over time.
I think I've got time for maybe one question before the break.
I thought Colin had actually answered most of these questions in the first part. You say there's no research. He's got a lot. You could check on that. And prescription-only model is already out as well. So
Not of the e-cigarettes, though. We can't prescribe e-cigarettes, can we? Well, we can prescribe it to be imported.
We can prescribe the nicotine.
Yeah. So that's that's right. We also have that one as well. We have both these top two models at the moment.
Well, I'm trying to get into these issues again with Adrian. I did mention the objectives, the concept of the mature smoking epidemic, which is something that René Batoon used to tell us. You know, that a smoking epidemic in China being a novel thing. You have you don't have the same number of people with really heavy dependence, but in a country like Australia, where most of the easy quit people have long quit, but the people who are still smoking are really the hardcore people. And I'm wondering whether the difference between countries, and Nick, I think you agree that might make a big difference to the expected outcomes. I imagine Adrian, you'll be talking about that in the second half. So let's take a break now and join up again in 10 minutes or so.